Welcome to today's session. So welcome to our panel, The Patient Experience of Access Challenges. I'm Laura, so I'm FinderCure's fundraising manager, and I'd like to welcome Naomi Litchfield, who's our patient advocacy manager on the early access programs at Bionical EMAS. So Naomi's kindly jumped onto this session after hosting the main event this morning, so you might have also seen her there. So delivering access to new rare disease medicines can be one of the biggest challenges in the development pathway. With the high price of the average orphan drug, access and reimbursement decisions can take years, and patients may be left in limbo or find themselves with the burden of data collection in managed access scenarios. So in this panel, Naomi will be introducing Olivia Vickery, a young patient whose extraordinary enrolment in an early access programme has had a huge impact on her life and condition. Lucy Carroll, a mother of two young children receiving monthly treatments throughout a managed access agreement. And David Rose, who has had a complete absence of treatment and would like to share his perspective on this. So welcome everyone, and over to you, Naomi.
Thank you so much, everyone. So just to give you a bit of background, so I'm Naomi Litchfield. I lead patient advocacy at Bionical EMAS. We are a clinical research organisation that specialise in running early access programmes. My background is clinical research nursing. I went into nursing because I was inspired by the care that my younger sister received for her 4 rare cancers. Her care was long and complex. She had a lot of operations and treatments. We grew up in Great Ormond Street Hospital. So I worked there at Great Ormond Street Hospital. I was in the NHS for about 15 years, and I've been in advocacy now for 5 years. I've had the privilege of caring for many rare disease patients and their families, a lot of them having progressive conditions, and I've administered lots of investigational treatments. So today I have got 3 very inspirational speakers, and I wanted to invite them here to tell you their invaluable insights into early access and medicines. And also, they're very close to my heart. We've all got Great Ormond Street links. It's a very special place for all of us, and I'm really excited to share their stories with you. So without further ado, we have Olivia Vickery here. She is 21. She's living with Morchio, and she was the first UK patient to have enzyme replacement therapy administered on her 10th birthday. And I'm very proud to say that I was the nurse that did that. So we've known each other now for 11 years. She went to Great Ormond Street every week for that infusion for 5 years with her brother Luke before she transitioned to home care. And she campaigned outside Downing Street for the access and funding to be continued, and is on a managed access programme now. And she's at university having weekly infusions still. And she's now training to become a primary school teacher. So hi, Olivia, and welcome.
Hello.
It's great to have you here. So I'll just briefly introduce everyone, and then I'll start with the questions, if that's okay. So our next amazing speaker is Lucy. So Lucy is a mother of 5 and has 2 children with Batten's disease, and that is Amelia and Ollie. She set up Ollie's Army when they were diagnosed with Batten's. She has been on this morning. She's met Theresa May. She's met Prince Harry. And she's been instrumental of going to NICE and speaking to them about Batten's and what that, and being on ERT and what that means to her and her family, and taking part in a managed access programme to help all Batten's disease patients. And she goes to Great Ormond Street every 2 weeks for their infusions. So really excited to hear from them. And then we have David, 31, living with Otwell Horn syndrome, the only person in the UK living with this rare condition. He is 1 in 300 million, and he's had lots of misdiagnosis at the beginning, a long, complex diagnostic journey, over 100 operations, choose to Great Ormond Street at the beginning, and now different hospitals in the UK. He's been in the media too, 1 in 17 rare campaign with Takeda. And he works for Rare Revolution magazine, and he's a Great Ormond Street ambassador and a really strong, not just rare, but ultra rare patient advocate, which I think is really important for the community. You might have heard from Ring 20 this in the session before, but I know that they think very highly of David, and it's great to have you here on our session to give a different perspective of not having treatment. So without further ado, let's start with our questions. So Olivia, let's start with you. Can you just tell me briefly what you can remember from your diagnosis story?
So my story was a bit different. Generally with Morquio, you're diagnosed quite early on and the signs are usually quite obvious, but it wasn't until I was 8 years old that I was diagnosed, and that was because I fell over at a disco and I really hurt my foot and I was complaining about it for weeks. So they eventually took me for an x-ray and nothing was broken, but they were like, it looks a bit weird, like we're going to continue testing. And so it was months later of a million needles and they came up with the diagnosis of Morquio, which is a genetic condition. So my brother also has it, but my sister escaped it, thankfully.
Thank you so much for sharing that, Olivia. I really appreciate it. I think I remember your mum saying that it took quite a long time to get you diagnosed and that she'd been to lots of different hospitals and different specialists, and it wasn't until you saw Ashok Velody and Great Ormond Street that you finally got that diagnosis just before your 8th birthday. I think that is that correct? But you had that fall at the disco, I think it was the October before, so that was quite a long time for your family to wait for a diagnosis. So thank you so much for sharing that. Lucy, can I come to you next? Can you tell everyone listening here today the diagnosis story for Amelia and Ollie, please? Thank you.
Yeah, thanks very much for inviting me here. It's a real pleasure. Thank you. So we have 5 children, but at the time when Ollie and Amelia were diagnosed, we had just had the 4. And basically, Ollie and Amelia were both born completely healthy. They were hitting all of their milestones. And it wasn't until the age of about 2.5 we noticed that Ollie had a slight speech delay. We brought this up with like health visitors and health professionals, but everybody just told us that it's fine, he'll catch up. And then he started getting clumsy and falling over his own feet. And again, professionals just kind of told us that, don't worry, he's just a boy, it's fine, that's what they're like. So we carried on, and then at 3.5, he experienced his first seizure. Now, initially, doctors told us that it was a febrile convulsion. He recovered really well, and we were told it would probably never happen again. And then, sadly, from then on, he started experiencing more seizures. They started off being a few weeks apart, and then it came to the fact that it was nearly every day he was experiencing these seizures. So we ended up having to take him out of our local hospital, who were they were doing their absolute utmost to find out what was wrong, but they weren't getting very far. So we took him up to the Royal Manchester Children's Hospital, and straight away CT scans were done. Initially we were prepared that he might have a tumour on his brain. And we were told that we could be in hospital for quite a while. So obviously we were devastated. And then those results came back the same day, and we were told, no, it's fine, he's got the all clear. So we kind of went from this really low place to like, oh, he's fine. So then he was diagnosed with generalised epilepsy. And again, we were absolutely devastated. And we can remember thinking, is he going to be able to drive a car, or what if he wanted to be a pilot? All these kind of random thoughts were running through our minds. And then we went to see a neurologist who just out of the blue just said, is there anything else that you're concerned about? And we explained that he had this speech delay and he was being clumsy. And the neurologist said, can you just get him to walk up and down the corridor? So we were doing it, and it was the one time I was praying that he was going to fall over, and he didn't. He just launched himself and ran as fast as he could up and down this corridor. But she ordered a MRI scan, and that scan showed that Ollie had a small cerebellum. So from then she ordered some more tests, and then he was sadly diagnosed with CNL2 Batten's disease. It was an horrific diagnosis, because we'd already Googled what Batten's disease was, and we knew that it was life limiting, and it basically rips children of all their abilities, the ability to walk, talk, to see, to swallow, causes uncontrollable seizures, movement disorders, and ultimately it takes their life between 6 and 12 years old. So when the doctor told us that that's what Ollie had, we already knew. And what was more horrific is Ollie was in the room when we were actually given that diagnosis. And I can still remember there was a junior doctor in there at the time as well, who was literally sat there shaking and crying, not knowing what to say or what to do. And it was awful. And we got handed an A5 piece of paper and basically told to go home and enjoy the time we had left with Ollie. And it wasn't until we did our own research and we actually found specialists in Great Ormond, down in the Evelina, in London, and we were told that it was genetic. So we had to get our other children tested, and then that's obviously when we found out that Amelia, who was only 2 at the time and she was perfectly healthy, that she also had the same condition.
Wow, Lucy, thank you so much for sharing that, and I'm sorry that you had such an awful diagnostic journey, and I think that a lot of people living with rare conditions can really relate to that. I think in those situations, the earlier you get diagnosed the better, but that's not always the case, and I think that you need a lot of support around that, and I'm sorry that at that time you didn't have that, and finding out that you've got a second child as well must have been really, really challenging. So I'm sorry, and I'm glad that you're able to share that with us today and that you're getting support that you need now. And I go on to David, please, just to tell us a little bit about your diagnosis story. So thank you, Lucy.
Thank you, Naomi. Yeah, so from when I was obviously very little, I started off being at Great Ormond Street. Kind of lots of operations and lots of things were going wrong, kind of internally, and also kind of my actual body as well. So kind of talking of milestones, I didn't walk until I was, I think, just over 2 and a few months. So obviously that's a lot later than average. I didn't crawl, I just went straight to walking. That's just kind of one of the main milestones that I didn't really hit. I was originally diagnosed with something called Ehlers-Danlos syndrome, which is now becoming a lot more well known, which is good. That was kind of a looser diagnosis at the time. It wasn't really a definitive diagnosis, but it was like a working diagnosis to have some sort of idea of what to call these random sort of symptoms and things wrong put together. Obviously that was many years ago. As I kind of got older and kind of went through puberty, and just as I became an adult, my body started to change more. Didn't really fit the bill for kind of a typical someone typical living with EDS. So it's all the common things that people know about it are joint hypermobility, problems with your valves in your heart, typically kidney and bladder. So although I kind of hit those sort of side of things, I didn't really fit. I think it's interesting because Ehlers-Danlos primarily affects women, or it's certainly the main percentage of people that I've met are women. So it was just kind of doing my own research and realised I probably didn't necessarily fit the typical bill for that. So from when I was 24 or 25, I started going to see the genetics doctor at Adam Brooks, which is the big hospital in Cambridge. We started off with some genetics testing, kind of did a bit of a family history. People know how that works with your mum and dad, and you kind of go around and see where things might add up. So I was originally diagnosed with Ehlers-Danlos, but obviously the new diagnosis is called occipital horn syndrome. It's an extremely rare disease, which is kind of similar to Ehlers-Danlos in some ways, but it's more to do with the copper pathways as well as the connective tissue disorder. So it took about 3.5 to 4 years to get diagnosed with that. There are a few kind of other syndromes that were mentioned, something called short syndrome, which is an acronym. That was something that was mentioned, and a few other things. So occipital horn syndrome is kind of linked to Ehlers-Danlos, but it's considered a milder version of something called Menkes disease, which is a lot more severe. And you're quite lucky if you make it past about 14, 15 with that. So now I've kind of got this diagnosis confirmed. It's something to work with, and we can kind of go from here.
Thank you so much, David. Wow, that's a real diagnostic journey, and thank you for sharing that with us. And I'm glad that you know now the diagnosis, and you can share with other people living with ultra rare conditions, like Ring 20 that we're just speaking there. I think it's quite different when there's only one of you in the UK compared to other rare diseases that have quite a few. So thank you so much, everyone. I really appreciate it. So Olivia, can you just tell everyone what you remember about taking part in the clinical trial at Great Ormond Street? I don't know if you can remember what you were told, and when you first went there. You were the first Morchio patient to get that ERT, enzyme replacement therapy, on your 10th birthday, and your brother Luke shortly after. Can you tell us a little bit about that and what that meant to you? And now having then going on to have home care and at university.
Yeah, so I don't remember actually ever being sat down and being like, this is your choice. It was kind of like, this is the only treatment available, you're having it. Like, my parents just wanted any kind of relief, because when you look up Morchio, it's not the most positive, you know, what's it called?
Condition. Yeah.
So obviously when the enzyme replacement therapy drug came up, we just jumped at it, and I hate needles. Always have, still do.
Yeah.
So you remember I was horrendous. I used to scream, kick, cry. I used to write notes like every week being like, I'm quitting, I can't do this anymore. But I have got better over the 11 years that I've been on it. And when it became licensed, we were able to have it at home. So that was 2014. And the difference was just so much better. As much as I love Great Ormond Street, getting up at 6 a.m. and traveling there, to be there all day in a chair is just, it's not fun. So yeah, being at home, I can have it. It's in a bag. I'm having it currently.
Right now, Olivia's been infused with her enzyme replacement therapy. It's amazing. It's that easy in a little bag. She can move around. It's great. Don't have that annoying beep, beep.
No, exactly. So it just made life so much easier. And then obviously going to uni, I was able to bring it into class, and it's just made life so much easier. So
amazing. And what about Luke? Can you tell us a little bit about your brother?
Yeah, so I started on my 10th birthday, but Luke actually had to wait 9 days until his 5th birthday, and then he could start, because at the time that was the minimum age you had to be. He was on it until 2016, and then he decided he didn't want to have it anymore because his fear of needles just became too much, and his cannulas were all failing, like his veins were just acting up. So they gave him the option. They said you can have a portacath, which is the medical device I have, but he was so traumatized because he'd had one in the previous year, and it got infected, so he was just having none of it. So he's come off the drug, and it's been quite clear how the drug has impacted him. Like, he has, in his development, like, he's gone backwards. I'm losing my words.
Okay, it's fine.
Like, he has basically got a lot worse in his condition. So his hips, he needs a reconstruction. He can't walk anymore. He needs crutches or his electronic scooter. So it's hard to tell whether that's just the condition or whether the drug had an impact on that. But yeah.
But how are you finding it on the drug, Olivia?
So I feel a lot better in my health. Like, I can still do everything I could do before, if not better. And like, obviously knee surgeries have helped that as well. But I think the drug has played a massive part in stopping the progression of the condition.
Thank you so much for sharing that, Olivia. That's really insightful. Wow. Thank you so much. Lucy, right, coming to you next. So how did you get on compassionate use for Ollie and Amelia? What happened? And now you're on a managed access programme. What does that mean?
Yeah, so basically once we had Ollie and Amelia's diagnosis, initially, to be perfectly honest with you, we just wanted to run away and get away from it all. So we ended up taking all the children to Peppa Pig World, and it was supposed to be a really lovely time, but unfortunately Ollie ended up having 14 seizures within one day, and it just turned into an absolute nightmare. But once we returned home, it kind of gave us that kick to know that we didn't want this for Ollie, that couldn't be his life. So we had to fight for him. So basically we just researched as much as we possibly could across the world, and we basically found out that there was a clinical trial going on at Great Ormond Street Hospital. But sadly, that trial had ended in the December 2014, and Ollie got diagnosed in the February 2015. So he wasn't eligible for it. So we hadn't heard of anything like a compassionate use programme before. It just kind of popped into our head, well, if there's this trial going on, why can we not get a compassionate use of the treatment? So we went directly to the company and we asked them, and then we found out that there was a charity called the BDFA, which is the Batten Disease Family Association, and we worked with the company, Great Ormond Street and the BDFA, basically to get a compassionate use programme up and running. We had loads of meetings, emails, and the company are actually based in America as well, so it was a lot of in the night telephone calls and up really early in the morning because of the time difference and everything. And then the initial point that I would say kind of made it for us is we got invited to Paris to meet with them directly, and I think the fact that they saw us as parents and us being able to plead and beg basically face to face, it actually like forced their hand really, and they actually opened 5 compassionate use places at the 5 centres across the world. So then we had to obviously go through the assessment period and making sure that Ollie and Amelia could meet the criteria. Now we had Ollie at one end of the scale where he was, deteriorating really, really quickly, and he might not have made it onto the compassionate use programme because it took us 16 months to get to this point. So he had lost the ability to walk and to talk by this point. So we kind of had to prove that he was still able to move by himself, whether that by crawling or rolling. And then we had Amelia on the opposite end of the scale, where she still wasn't showing signs of the disease. So they were saying that she was too well for the treatment. So eventually we managed to get them both on, and heartbreakingly, when one of our friends' little boys didn't get on because Amelia did, because he was too poorly. So that was really, really hard for us. So yeah, that's how we got them onto compassionate use. And then we basically then were patient representatives, and we went through the whole NICE process, which was a grueling 2 years. We went to all the meetings that were held both in London and in Manchester, and we were able to present our children and the data and listen to everything. It was really incredible, really, to hear everything and everybody working together, all the professionals at Great Ormond Street. And initially they actually came back and NICE decided not to fund the treatment on the NHS, which was obviously absolutely devastating, because that would mean that the treatment that was slowing down the progression of the disease would be removed from Ollie and Amelia and the other children. So we decided to take legal action personally, and thankfully that overturned NICE's decision, and it's now available on a managed access agreement over a 5-year period.
And did you take Ollie and Amelia with you to NICE?
Yes, so at the NICE meetings, we actually asked whether the panel would meet the children, so that they could see for themselves and show that they are children, they're not just a number. And they said no, they refused to see them. But the building in Manchester where it is, it's an indoor building, so you are allowed in the reception area. So we actually ended up taking the children down there because we knew that the panel would have to walk past them to get into the building. So basically we just had Amelia running up and down the corridor, So even though they weren't officially allowed to see the children, they saw them. So and we just thought that was so powerful, because she was waving at them and tried to stop them and talk to them, and they were like, "We're not allowed to speak to you." So I believe personally it had a massive impact.
Thank you, Lucy, for sharing that. Wow, amazing story. Thank you. Very insightful. And I think a lot of the audience here today can either relate to that or find that quite moving and powerful. So thank you very much. David, to you. So you haven't taken part in a clinical trial or an early access program, but if you were offered that, would you consider it? And is there anything else that you're doing to research your condition or work in the ultra rare space?
So obviously it's a little bit different to the other ladies. There's no sort of clinical trial pending for my condition. I think if I would have had Menkes disease, which I mentioned earlier, as far as I remember and know, they do have a gene therapy program in place. So obviously if you'd have been diagnosed that and kind of very early on, you would have been lucky enough to maybe have gene therapy. Obviously currently there's nothing for my condition. It might change at some point. I think because it's kind of when the kind of conditions change. So when Ehlers-Danlos changed their classifications, I think there's 5 different types now, but there used to be about 11, of which occipital horn syndrome is one of them. I think kind of when things are this kind of ultra rare, it can make life a lot harder, because you're kind of on your own. There isn't a patient group for my condition. I don't really fit. I kind of like a grey area for everything. I'm sort of too old to be a young person now. I'm not, I don't fit that bill. I don't fit any other kind of criteria of other groups. There's no patient group. So sometimes when you're in a position, it can be quite difficult to learn what's going on. Like anything that I see is kind of me researching it. It's not like I'm hearing it through other people that are passing on information. Sometimes I think you have a bit of a burnout after a while. I think, being honest, I think I've already experienced it, where I've been diagnosed this condition for sort of 5 or 6 years now, but nothing's kind of really gone, like nothing's really progressed with it. So I think I need to kind of give myself a push again to try and start seeing what's out there. There's a doctor in America that has some knowledge of my condition. Kind of by default, there's only maybe 4 or 5 doctors, so he's one of the specialists by default. And the doctors that I see at Adam Brooks and at UCL in London, they've got knowledge of it, but in terms of kind of clinical trials, there's nothing really going on. I think it's kind of as you get older, it gets more difficult, because kind of the kind of copper replacement things they've spoken about, that's mainly for children and sort of toddlers really. So I think I've kind of maybe missed the bill on that, but certainly if anything kind of came up in the clinical trial world, I definitely would be willing to do it. It's just kind of trying to find out how it would happen and how I would kind of push for something, because obviously the limited amount of people, there's an estimated 25 globally with this condition. I've met 3 others. It's kind of, as a business case, it gets harder to try and push it. So yeah, if something came up, I would definitely be willing to try it.
Thank you for sharing that with us, David. I know that you've been very willing when you've done to your appointments at GOSH and UCL and Adam Brooks for medical students and junior doctors to come and meet you and interview you and find out a bit more about your condition. So just say thank you for doing that. And it's very
I think that's quite an important thing, because that's kind of, I guess, I think for like kind of the future generations that may have this condition or for other things. I think in general, like if the more people that can help medical students, the better, because that's kind of my way of kind of not giving back, because it's not giving back, but that's my way of trying to help, because if I kind of can't help with other things, at least I can do that. So it kind of gets normal now where they say, oh, can I bring in 19 medical students to your appointment? And it's fine, because it's good, because that's how like the future generations will actually learn. Like a textbook will go so far without being cliche, but you'll really learn by kind of seeing somebody in the flesh. And kind of even when I've been really poorly, after operations, things, I've always said yes, because that's the kind of reality of a rare disease. It's not always like the fun smiley side that we can do. It's also, you need to see the rubbish side where you're really feeling awful. So yeah, that's what I like to try and do, and I'll always be willing to help.
Thank you so much, David. I think that's really important to highlight that there, and to see you, yeah, having different procedures and operations, and when it's raw and real, not just in a format like now where you're looking very smiley and happy.
Good at basket.
So back to Olivia, what are your experiences of collecting what they call real world data, and do you think it's important? And yeah, anything you can share with us for your personal experiences, Olivia, being on a managed access program and clinical trial, and yeah, having to do lots of assessments.
Yeah, so I have mixed opinions about collecting real world data. So because Vimizon is so expensive, there's a lot of pressure put on it to make sure it works. So it's constant testing. I feel like it has got better. It's like every 4 months, every 6 months for some of the tests, but some of them I find conclusive, like a lung function test. You can't really fake that. But things like a 6-minute walk test, like if I've been walking all day the day before, I'm not going to walk as fast. Whereas if I've done absolutely nothing the day before the next one, I'll walk so much further. So I think some of the testing is good, but some of them, it is just a snapshot of a small part of my day. So
completely agree. And 3-minute stair climbs, you used to love that, didn't you, Olivia?
Loved it. Best part of my day.
What about the questionnaires? Do you think any of them are relevant to you, or the questions that they ask in the quality of life questionnaires?
At the moment, no. I think some of the questions, it does make me think, am I going to think differently in the future? But so far, like when they say, how unhappy are you? It's like, oh, I'm quite happy at the moment. But I don't know. I guess it's just to kind of keep track of you. And it's nice that they're looking out, but I don't know. I'm young at the moment.
It's not always that meaningful, is it? So maybe they should ask you and other people living with Morkia at the beginning to help them decide what questions they're going to ask you. I think that maybe would be a better idea. What do you think?
Yeah.
Lucy, what are your experiences with your children, with Ollie and Amelia asking you to collect all this data on a managed access program? And I suppose that's highlighted really of how important it is, and maybe you feel, I don't know, I know you've shared with me before, a bit of pressure, and Amelia was the youngest starting on the ERT, and I suppose everyone feels like she's on a spotlight.
Yeah, so I agree with Olivia really that so the testing is obviously all of it is really important, but yeah, so for Amelia, because she was one of the youngest children in the world, and now that was almost 4 years ago now that she started this treatment, and she's doing incredibly well. It's kind of all eyes on her all the time. And I feel like even on our personal like Facebook page that we have for Ollie's Army, I feel like, well, we know from past experience that NICE and NHS England, they are watching the page. So we feel like even then we can't say everything. Because it's just so much pressure on just not just us but for her as well. There's so many tests, and something that we're really passionate about and wanting to change is the real world data, because for Amelia to sit in a like hospital room with somebody that she doesn't really know, it might be the first time she's seen that person, to do like a speech and language assessment or a psychology assessment.
Very intimidating.
Yeah, sometimes it can be after an infusion, which we travel from like near Manchester down to London, so it's like 4 or 5 hours. Then she can have a brain infusion, which is another 4 hours, and then she has to go into a psychology assessment where they're saying to her, oh, will you put the baby under the table? And you kind of look at her and she's thinking, baby doesn't belong under the table, what are you asking me to do that for? So we're really keen to get the real world data, as in the teachers at school doing these assessments and then sending them in, rather than just having, like Olivia was saying, that snapshot of just that time in the day when you don't know what's happened the day before or what's happened even during that day. And to be honest, like a lot of children, they're not performing monkeys. If you ask them to do something, they won't do it. Whereas if you've got the school, for example, they've got like 6 months to do all these assessments in, and then they're more likely to see what that child is actually really like, rather than just that snapshot.
No, completely agree. Thank you so much, Lucy, for sharing that. And I don't know if anyone listened to Apparito and Ring 20 before, but I think Dan from Apparito really explained that well, the different wearables that they've been using in specific conditions and how it's actually tailored to that condition. And over like an average of, say, a month, they can say how many seizures or what they've been able to do, rather than just a snapshot in time in the clinic asked by a physician, which the child doesn't know or trust or feel comfortable with. And like you say, all that travelling, that's 10 hours of travelling as well as a 4-hour intrathecal infusion. It's a lot of pressure on the child. So thank you, that's really interesting insights. And David, anything to add from you? And I know that you've been having lots of different assessments and procedures, over 100 operations, and how you've kind of felt doing those, and your kind of insights to collecting real world data, if it's important in rare disease and ultra rare.
Yeah, no, I think it's important. I think obviously kind of due to the different conditions, obviously Olivia and Lucy's probably a bit different to mine. I think that the amount of data that's been collected on me in a kind of different setting is a lot less. Kind of probably the more recent thing where I had a different, something that's not rare, it's called POTS, which is kind of a really common comorbidity of having a connective tissue disorder. So POTS isn't really rare, but it's kind of linked to lots of rare diseases. So that was kind of the most recent kind of testing thing where I've had lots of different set up on lots of machines and kind of monitoring lots of things to see whether I was positive or negative for this condition. But kind of generally, I think that it's good to collect all this data. The data's there to help. It's not just there to help you, it's to help other people kind of really with your condition. So the more data they can collect, like, you can kind of extrapolate trends and see where it actually leads to. So I personally think it's a good thing.
Thank you so much for sharing that. I really appreciate it. And hopefully all of this data that everyone's taking part in is going to help the future generations of patients.
So just to Olivia, Lucy and David, thank you so much for this brilliant session that's been available to us. Has anybody got any other questions they'd like to, or did Naomi want to add something? We're going to probably
I just wanted to touch on that. Lucy and Mike have set up a fundraising page for Ollie's Army, and Lucy, if you just wanted to touch on that, I think it'd be nice to share. And if everyone's thinking about maybe a charity to support this Christmas, instead of sending a Christmas card, maybe you could send £1 or £2 to Ollie's Army.
Oh, thank you so much. So basically the treatment that Ali and Amelia are receiving now is a brain infusion, which happens every 2 weeks over a period of 4 hours, which is slowing down the progression of the disease. So because Amelia was so young when she started, which was all because of Ollie being diagnosed, she is still able to walk, talk, go to mainstream school. She can still eat. She's nearly 4 years seizure free, and this is all thanks to this treatment. But sadly, the treatment won't cross the blood-brain barrier, which means that she will still go blind. So touching on that quality of life that was mentioned before, which is hugely important, and I agree with everything the lady was saying. If she was to go blind, it'd be absolutely devastating. And all this that she's learned to still be able to keep and do, and to run around with her friends and go to school, all that would be detrimental basically if she was to go blind. So basically we've been handed this really amazing opportunity by professionals at Great Ormond Street who want to put together a compassionate use kind of clinical trial of putting the enzyme that they use in the brain directly into the eye, which would take place every 2 months. But basically to do this, they need £250,000. So we are basically, we're now in a race against time because Amelia's 7 and she's very, very nearly 8, and Ollie was 8 when he lost his eyesight. He is now blind, so it wouldn't help him. So we've kind of set up fundraising events on Ollie's Army, which is Ollie's Army Battling Against Battens on Facebook. We're also on Twitter and Instagram if you want to follow us. And we're just appealing for everybody's support, because obviously it is a huge amount of money to raise, But what's really important is, although we're, you know, supporting our child and trying to stop Amelia from going blind, this will help many other children that have got this same condition. It is not just for Amelia. So Mike was going to do a really big challenge at the end of November, but the same day he was going to announce this challenge, Boris Johnson announced the second lockdown. Obviously fundraising for all charities at the moment have been, you know, hit hard, and we just can't do any events. So he is actually going to be running from Berkwytt upon Tweed to Great Ormond Street Hospital, which is a total of, I'm just going to get this right, 387 miles. So
wow, that's incredible.
Yeah, so it is over 32 miles a day that he will be running. He will be away from us, away from the family for 13 days to do this. So I feel like it's a challenge for me as well, to be on my own in the middle of a pandemic with 5 children. But we're just trying to like get the awareness out there of ultra rare diseases and save Amelia's sight, raise this money, but also just bring everybody together, basically, because we've always said that whatever we do, Ollie and Amelia are always smiling. So whatever event or challenge we put on, it's to bring everybody together and just make something really positive and special out of something that's, you know, it's just something so awful. So we're just appealing to everybody. So even if you can donate the amount of a Christmas card, or if you can't donate, because I know lots of people are, you know, really struggling themselves, but if you can just share it everywhere, all over social media. If anybody has any contacts with like newspapers or, you know, televisions, we're just trying to do our best basically for all these children that are battling this rare disease.
Thank you so much, Lucy, and thank you for explaining that. It's so important. And I think there's a lot of people and families in the same position as you, fighting for access. And I think that getting diagnosed with a rare condition is devastating and very challenging. But I think there's one thing worse, and that's having a treatment out there but not being able to have access to it. So let's try and get people access as much as we can. And like Lucy said, if we can fundraise that and get that set up, that would be incredible. So thank you for your time, everyone. Thank you for listening. And if anyone has any questions that we haven't been able to answer, please send them via the chat, via the email. We're here to help and support you. And I hope you've enjoyed the session and Find a Cure. Thank you for having us. And we'll hopefully be back soon. So take care. Enjoy the rest of your day.
So thanks everyone so much for taking part. Take care.
Thanks, everyone.
Thanks, everyone. Cheers. Bye.
Thank you.
Everyone. Thanks, guys.
Thanks.